And it was established by Dr. Akram Ahmad, who is an educationist and a healthcare professional with years of experience across several roles in India, Malaysia, and Australia. Academically offers support to healthcare professionals who wish to upscale their careers by migrating to Australia and other countries as well, setting new standards by providing preparation courses for the most advanced global healthcare exams. And Academically offers guidance, resources, and unwavering support to all the people. Now, a little bit about Dr. Akram. He's the founder and CEO of Academically, as we all know. He is an esteemed clinical pharmacist, a distinguished professor, and an accomplished research scientist with an impressive 15 years of teaching and research experience in India, Malaysia, and Australia. And he was determined to help healthcare professionals across the world to achieve their dream of moving abroad. And this is the reason Academically was started. And through this initiative, he provides educational training for pharmacists, medical doctors, dentists, nurses, technicians, and physiotherapists for various registration exams so that they can move to their dream country. And today we are focusing at pharmacists, although so many webinars happen that focus on different domains in healthcare. And to further support the career advancement of healthcare professionals, he has also now launched a study abroad program for those wishing to pursue higher education abroad. And Academically has got an amazing faculty, academic heads. Dr. Alok Semwal is a seasoned pharmacy expert with a PhD in pharmaceutical sciences. He has got more than 14 years of professional experience as the assistant academic head at Academically. He leads the development of innovative pharmacy courses, contributing significantly to educational advancement in the field. Dr. Semwal is also a respected editor for several scientific journals and has authored numerous scientific articles and book chapters published in renowned journals. And we have our faculty here, Dr. Nishtha, Tina Nazim, Linda Maria Jose, Femi Maria Francis, Kiran Shafiq Siddiqui, Payam Vohra, who you've just met, Ahmad Karamat, Muhammad Kamar, Dr. M. Nadeem Zahid. So I think it's a good time to start the masterclass. Over to you, Payam.
Yes, thank you very much, Jaspreet. And I hope the energy is high. We all are enthusiastic. And greetings of the day to all the participants out there on YouTube as well as on the Google Meet. Right? So during the session, you're free and the comment section is open. You can drop in your doubts, your queries, silliest queries as well. And we are there here to guide you. Let me brief you before I start presenting my screen. Today's class is going to be a class of clarity. So OPRA exam is easy. Let me tell you how. Mostly people consider that cracking OPRA is difficult. Not at all, my friend. If you know what is to be read, how much is to be read, and in what depth we have to read, everything becomes a cakewalk for us. So today we are going to have a master class on the topic antimicrobials, antibiotics. All right. So if you carefully observe the syllabus of OPRA, it is divided into 4 sciences: biomedical sciences, where you have human anatomy, physiology; pharmaceutical sciences, where we have pharmacology, therapeutics, toxicology; clinical sciences, where we have some case-based scenarios, some clinical cases. All right. And social, administrative, behavioral sciences like medication safety, patient adherence, counseling, etc. So today's session is going to give you a clarity that what we are going to provide you at Academically, because we have a repository of recalls. Yes, abundant plethora of questions with us that help you, and we have a library created for the notes as well, because we have a lot of qualifiers with us who have qualified the OPRA examinations and now have outperformed to their core and have a great caliber. So with us, definitely we have a lot of, and we all know that we do not get the question paper for OPRA, so we all are dependent on recalls. So we have a set of recalls that you will be also and a few questions we'll be discussing as well. So based on that, our content team has curated these presentations by a thorough research. So the first class, let's begin. But before that, can I have all of your in the comment section, can I have everything that you know about antibiotics? Can you all comment randomly? When I take the word antibiotics, what is the first thing that comes to your mind? What is the first thought that comes into your mind? Antibiotics sunke hi, when you listen to the word antibiotic, what strikes your mind? quickly in the comment section on the YouTube as well as on the Google Meet. All right, as well as on the Zoom. Everybody. So antimicrobials, what kind of questions we can expect? Firstly, the questions directly pop up from the examples. That which is an example of a tetracycline, which is an example of aminoglycoside, which is an example of macrolide antibiotic, beta-lactams. All right. Second, the question comes, which are bacteriostatic and bactericidal agents? So we have a table that clearly distinguishes the agents that restrict the growth and the agents that kill the growth of the bacteria. All right. Then the questions come up from the pharmacokinetic parameters like ADME, absorption, distribution, metabolism, and elimination. All right. So we have Raj who says antimicrobial resistance. Very good. You know, there have been questions on the mechanism of resistance as well in CAPS previously, which is now known as OPRA. Very good. Then the fourth domain, please write down these. First domain is the mechanism of action and classification. Second domain is your PKPD. Third domain is your clinical uses, contraindications, and pregnancy. So which drugs are indicated in pregnancy, which drugs are contraindicated in pregnancy. All right. Complete information, because according to the content that we have created is as per the Australian Pharmacy Council with the reference to AMH, that is the Australian Medicine Handbook. Absolutely. So mostly, people provide the content from random Indian books and authors, but the content that we have made at Academically is a collation from the Australian Medicine Handbook as per the TGA guidelines. So in the comment section, can I have everybody out there typing what is TGA? A hint for you, it's a CDSCO, as just like similar to CDSCO of India. So what is TGA and what is the full form of TGA? Everybody. All right. Quickly, we can type in the comment box. All right. Moving forward, that's the fourth domain from which question comes. And the fifth domain is specific indications. Okay, which is a drug of choice in methicillin-resistant Staphylococcus aureus? So immediately your answer must be linezolid vancomycin, right? So there are direct indication-based questions. Okay, which is a drug of choice in rickettsia Lyme's disease? So doxycycline, immediately, and we'll prepare you in such a way that everything will be at the tip of your tongue. Because syllabus of OPRA is like an ocean. It's like an ocean. It's how much ever you study, it's not going to get covered up. So what important chunk you need to focus upon and what all topics you need to come thoroughly read, that is what we are going to provide you in this course ahead. So let's start with the antibiotics. This is a very, very beautiful image. Your memory is a collaboration of three different visual, muscle, and audio. Whatever you are listening to me, whatever you're watching out on the screen, and when you're watching it, you're writing it down. Many people have the same complaint. They tell me the same thing. Okay, sir, we are not able to remember and recollect things. We read, but we forget because we are not using a combination of visual memory, muscle memory, and audio memory. Absolutely. So you must be aware about this, that whenever you have a combination of these three, remembering anything, recollecting anything is very easy. It's going to be very, very easy for you. All right. So here we have a categories of drugs. The first category of drug that we have is protein synthesis inhibitor. So we all know that the protein, the bacterial protein, if it's synthesized, it's going to lead to replication, and then by the process of translation, proteins are synthesized and the further invasion of bacteria occurs. So let's inhibit this protein. Who will do this? Macrolide antibiotic, chloramphenicol, tetracycline, aminoglycosides, at MC. Aminoglycosides, tetracycline, macrolides, chloramphenicol, where aminoglycosides and tetracyclines inhibit the 30S ribosome part. All right, so this is a ribosome. So this is a 30S ribosome, which is involved in the protein synthesis. We all know the cell organelle ribosome is a site for protein synthesis, correct? And this is a 50 Swedberg's ribosomes. So the 30S is inhibited by the aminoglycosides, tetracyclines, and on the other hand, macrolide and chlorampphenicols inhibit the 50S ribosomal subunit. All right. Moving forward, another organelle to damage is the cell membrane. So mostly the antifungal drugs like daptomycin, amphotericin B, polymyxin, these are the agents that inhibit the cell membrane, cell wall cell wall or cell membrane. The third target is producing false metabolites or anti-metabolites. So many a times, we there is production of agents. It's like giving a dhoka. It's like giving it's a metabolite that is similar to the structure of the actual ligand, but is not the ligand. It is just pretending to be that drug. So these are known as anti-metabolites. So here we have sulfonamides. In the chat box, yes, I have a lot of thumbs up and a lot of hearts that are being popped up out in the session. Thank you so much for so much of love. So can I have few examples of sulfonamides quickly? Can I have few examples of sulfonamides in the chat box? All right. The fourth category of agents, that is the fourth target, is the cell wall inhibitor. After protein synthesis, cell membrane, anti-metabolites, the cell wall. Cell wall is inhibited via, or the synthesis of the cell wall is restricted via beta-lactams, vancomycin, cycloserine, bacitrexine, phosphomycin. All right, these are the four agents. And finally, DNA replication inhibitors, fluoroquinolones. Fluoroquinolones, which are DNA, which are replication inhibitors. Those are known as fluoroquinolones. All right. Are we all clear till here? Any queries, any doubts, anything which we wish to ask? Then quickly comment down. Sir, you told that the questions directly come up from the topic of bacteriostatic and bactericidal. So let's discuss that directly. So what are these bacteriostatic, bactericidal agents? Remember any one of the side. All right. Agar aap dono yaad rakhoge, if you remember both of it, it's going to make you fall in trouble. Remember either the statics or the sedals. I would prefer you to remember only the sedal ones. So aminoglycosides show a concentration dependent activity. Then we have metronidazole, which is a very, very good drug for amoebiosis. Fluoroquinolones, very, very good drugs for urinary tract infections. Amphotericin B, antifungal agents. And phosphomycin and beta-lactams. Phosphomycin and beta-lactams. So also in the comment section, there is now the WhatsApp group link. You can all join to the group as well. All right. So that you can connect to us and you cannot miss any updates. So all the updates will be, communicated to you via the group. So quickly you can join in, click on the link and join on that group. Right. Ciao. So these are the bactericidal agents. On the other hand, these are the bacteriostatics. Remember any one of them. You can either remember trimethoprim, paramino, salicylic acids, dapsone, ethambutol, nitrofurantoin, or you can remember the bactericidal ones. It depends upon you which part you want to remember. All right. Very good. Bacteriostatic, very good. Shivam is the one that stops the growth while Sidal inhibits the growth. Excellent. Kya baat hai. Very good. Very good. So I hope that we have the same energy high throughout the session. Because aaj ki ye session, from this session, you're going to get a lot of clarity out there. All right. So please stay tuned till the end. Beta-lactam antibiotics. So what is beta-lactam? You are taking this name beta-lactam from a very long time. What do you mean by beta-lactam? So beta-lactam is this four-membered structure having a key carbonyl group, an amine, a nitrogen, sorry. This is beta-lactam. And when it's fused with a thiazolidine ring, it is known as a penicillin. When it is fused with dihydrothiazine ring, what is it called? If I'm fusing a beta-lactam with thiazolidines, it's called penicillins. If I fuse beta-lactam with dihydrothiazine, what is it known as? Kya bolenge hum usko? What do we call this? When we combine beta-lactams with, very good, excellent Sudha, cephalosporins. Kya baat hai? Yes, I feel the energy is low. Why so? Everybody, we can quickly type in the comment section. Yes? Should I speak in some other languages to you? Yes? Ella and Aru. Yes? Ki cholbe. Su chale che. Yes? Kya chal raha hai sabhi log? Hanji mai ladlo. Ke karan lag gaye wo sare. Everybody. That's great. That's great. All right. Cephalosporins. Very good, Inshram. So that is known as cephalosporins. And when you do not fuse any ring, it's called monobactam. Mono means single. right? So monobactam when there's no ring fused with beryl atoms. And finally, the carbapenems, where we have, rather than the sulfur is removed. So we only have pyrrolidine ring, 5-membered ring, pyrrolidine. That's called carbapenems. Right, Paritosh? Good to go. Very good, Danish. All right. Yes, very good, Muhammad Ali. The examples are, carbapenum, imipenum, meropenum, dorepenum, ferropenum. Very good. Excellent. Excellent. Kya baat hai. So these are the structures of penicillin you can observe. The beta-lactam ring fused with a thiazolidine ring. Similarly, a beta-lactam ring fused with a dihydrothiazine ring. Cephalosporins. A beta-lactam ring fused with a pyrrolidine ring. No thiazolide, no sulfur. The heteroatom sulfur is absent. Correct? Yes, Ferrogen is the brand name. Very good. Kya baat hai, Tausif. Good job. So these are the different agents that are being falling under the category of beta-lactams. है ना, मतलब parent is beta lactam and उसके बच्चे अलग अलग, every child is different, right, of the parents. Some child is notorious, some is silent, some is full of wisdom. So every child is different. So here the beta lactam is an umbrella term which encompasses monobactams, carbapenems, cephalosporins and penicillins. Sir, now these penicillins ka classification, it is so big, so vast, how are we supposed to remember it? So whenever you study the, let me stop sharing now for a minute. Whenever you study pharmacology, okay, I'm giving you 4 important criterias from which aspect you should study this pharmacology. All right. Number 1 is the mechanism of action and classification. If there's a drug, agar koi ek drug hai, how is that drug acting and what is that drug falling, which category is that drug falling under? So mechanism and classification. Number 2, the adverse drug effects. If the drug is acting on the body, is it having any secondary effect? Is it having any side effects? Correct? Third, clinical interactions. What if with that drug you are having a polypharmacy history? If you're having diabetes, hypertension together, so you are going to have 2 medicines together. If you're having asthma, hypertension, so can you give propranolol to an asthmatic patient? Obviously, no. Propranolol will block the beta 2 receptors and cause bronchoconstriction. So it will worsen the asthma. It will treat hypertension. That's great. But on the other hand, it will lead to asthma. So that's a third thing that you have to study. And the fourth is important PK parameters. The books, the AMH, it's so vast that you do not know of what extent and what are the important pointers. So we have extracted those pointers from you. So if you read these 4 points, mechanism, classification, clinical interactions, adverse drug effects, and important pharmacokinetic parameters, nobody can stop you from qualifying OPRA, my friend. We have seen so many batches with us who have qualified and they have completely followed us. So I hope that you all thoroughly have faith in us and read whatever we will be instructing you all to. All right. So penicillins, the natural sources penicillin is penicillin G, penicillin V, while the semi-synthetic penicillins are cloxacillin, methicillin, nafcillin. Okay, CMNO, common. Cloxacillin, oxacillin, methicillin, nafcillin. Similarly, route of administration, which are parenteral. So we have penicillin G. Acha, penicillin G is a drug of choice in which condition? Do we know? Penicillin G is given in which sexually transmitted disease? It is given in the syphilis caused by Treponema pallidum or spirochete bacteria. Syphilis. All right. So penicillin G is given in syphilis, and the adverse effect of penicillin G is anaphylactic shock. Anaphylactic shock, which is treated by epinephrine. So, every small pointer is linked to some of the other pointers. So that is why this is the beauty of pharmacology. Then we have the spectrum. In the broad spectrum, we have amoxicillin and ampicillin. You would have heard about amoxiclav, augmentin, commonly used formulations. Correct? Very good, Arnav. Kya baat hai. And also, I would love to know that how many of you are also working Like, because you can just type in the comment like, whether you are preparing for only OPRA or are you even working as a pharmacist professional or a clinical pharmacist. You can quickly type in the chat box as well. Let me tell you, this is one of the very, very important topics of penicillin. It's going to be extremely vital. All right. And the entire category of beta lactams is very, very important. All right. Pharmacist in Bahrain, MPharm, that's great. Good to hear. Then resistance to acids. We all have acids in our stomach, correct? Acids degrade. And many a times in the night, we say, no, dil jal raha hai. Our heart is burning. Your heart never burns. Dil kabhi nahi jalta. It is because of the reflux of the acid, which is causing a harm to your gastrointestinal esophagus, which is causing a inflammatory response to your GI tract, which is leading to a feeling or a sensation of heart being burned. It is nothing but a GERD, gastroesophageal reflux disease. So that is, resistance to acids. So some drugs are acid stables, like we have penicillin V. On the other hand, some drugs are acid unstable, like penicillin G, methicillin, nafcillin. All right. Are we good to go? Everybody. Next up, we have some examples. So in these examples, this is very, very important that you know the mechanism. Okay, bhaiya, we have read penicillin, but how does it work? Yahi nahi pata. So penicillin, natural penicillin, we have penicillin G, which is a parenteral penicillin. And most of the penicillin G is parenteral. It is never given by oral route. You cannot give it by oral route because it is acid labile, correct? Oral doge to it will be degraded by acids. Insulin, have you ever given insulin orally? Why? Sir, it's a peptide. Proteases will degrade insulin. So that is why it is never given via the oral route. You give it through the subcutaneous route, right? So that is why penicillin G is always given parenterally, whether it is a procaine form or the benzathine form. There are two forms of penicillin, benzathine and procaine. So it is always given about. So tell us something about OPRA. Danish, this session is all about OPRA, my friend. This is all about OPRA. If you like to know more about OPRA, definitely our counselors will connect to you. You can drop in your doubts on the numbers that will be provided to you soon for the counseling session about OPRA. What is OPRA? All right. But today is a master class where you're going to learn कि OPRA exam crack करने के लिए, in order to crack the exam, what you need to study, how much in depth you need to study, and from where you need to study. All right, that will be the topic of discussion in today's class. So I hope that we all have the same energy, right? It's a festive season. Happy Navratri to all of you. Yes. Chalo, let's move forward. So when I talk about the mechanism of action, easily, I'll just stop this sharing of the screen. I'll explain it to you. Just give me a minute. All right, everybody focus on my hands out here. So this is a cell wall. All right, and how is this cell wall made? This cell wall is made when the cross-linking of the NAM-NAG, N-acetyl muramic acid, N-acetyl glucosamine. We say, no, shake hands, let's shake hands. When you shake hands, they merge and they form a tight, rigid bond, correct? So when the NAM and NAG cross-link each other, the cell wall becomes rigid. And it is a rigid cell wall. So now what happens? We give penicillins. So penicillins come. They say, I cannot see this bond. I need to break this NAM-NAG cross-linking. मैं खुश नहीं देख सकता इन्हें. I need to break them. And this penicillin acts on this NAM-NAG bond and it breaks down, disrupting your cell wall. So your cell wall, which was tightly bound, rigid in nature, is now disrupted. It's now disrupted. All right. So that is how the penicillins work. And OPRA is not about mugging up, cramming up things. People say usually in the Indian examinations or any other examinations, mostly people cram up, mug up and concepts and just go. That's not going to help you, my friend. OPRA is about fundamentals and applications. And the list of faculties that we have, Kiran ma'am, Tina ma'am, Nishtha ma'am, sir, a lot of people that we have on board are all, many of them are qualified OPRA as well. And they all have a great background. So they will help you to understand the fundamentals and concepts. That's the reason why you are in pharmacy, to understand the medicine, not by heart the medicine, right? I hope we all have the high energy. Yes, Paritosh, Rayan, good to go. Pratik, what is the syllabus for OPRA? Pratik, I've already mentioned in the beginning. It is biomedical sciences, social sciences, pharmaceutical sciences, and clinical sciences. The weightage we'll discuss it soon, that which is 35%, which is 25%, which is 15%, which is 10%. But these are the four major domains. All right. Biomedical sciences, clinical sciences, pharmaceutical sciences. Now, sir, one important point from the PK. All the penicillins are excreted in urine except the naphthalene, because naphthalene, being a good molecular weight drug, having a naphthalene ring, नाम नहीं है. You know, William Shakespeare once said, "What's in a name?" So naphthalene के name में ही naphthalene है. That is why it is eliminated by the biliary route of excretion. That is naphthalene, which is eliminated by the biliary route. All right. Probenecid. Now, sir, drug interactions. You have told 5 points. You have covered mechanism via inhibition of the transpeptidation cross-linking of cell wall. Classification. Yes, I've covered penicillin's classification. So you have covered about the PK parameters. Yes, I covered the important PK parameter. So what about the interaction? I covered about the adverse effects. Yes. Sir, Arnab sir called me. All right. Danish, if you wish to talk to any of our counselors, the numbers will be communicated soon. They will definitely contact you. So do not worry. All right. Adverse drug effects and now interaction. So probenecid inhibits the penicillin excretion. So if it is inhibiting, will the plasma level of penicillin increase or decrease? Can I have few answers in the comment section as well? If probenecid is inhibiting penicillin excretion, plasma level of penicillin is going to elevate or is it going to reduce? Yes, everybody in the comment section, can I have your answers, please? You have so many people out there. Shubham, Abdur, Sagar, Ganesh, Shrikant, Deep, Ramnapali, Shafaq, Paritosh, Ria, Sudisha, Melab, Kunal. Can I have few answers from you all? Rahat, Vishal, Raghav, Juliet, Akriti, Monica, Muhammad, Giri, Milind, Manoj, Amir, Sudha, Giri. So I think so I had to take your name to make you active. Yes, Shoaib, Yash, Prajwal, Mahira, Alisha, Rathod, Mohan, Neha, Saida, Kaif, Siddiqui, Pranjali. Are we all there with me? Pooja, Shivam, Fatima, Keshav, good to go, Zahra, Sakshi, Megashri, Nitish, Tawhid, Shreyas, Arnav, Satyavir, Abdul, all good with me? All good, all everybody with me on the same page. Abbas, Ashutosh, understanding everything. Surya, Shubham, Saima, Ravi, Himanshu, Himanshi, Partha, good to go? Chalo, बहुत बढ़िया. Very good. All right. Chalo, let's move forward. That's the great energy. You know, in the evening of Saturday evening, you all have come here. You know, you are already one step closer to cracking opera. Ask me why. It's a Saturday evening. Maybe party mode would be on, or some you will be happy, you will be in a very euphoric condition, but still you are all attending this webinar. That means you have a passion, you have a zeal, you have that target focus that you have to achieve something. So you're already ahead of a lot of people. The only thing you need to streamline of your study plan and the timetable and the schedule. So I'm really appreciating all of you that you all have come for this webinar. Absolutely, that's amazing to have you all out here. Adverse effects, as I mentioned, anaphylactic shock, your entire body becomes red. There are red spots and red patches. It's an extreme condition and needs immediate, you know, in a hospital, if you go, there's a term called crash cart. So in the crash cart or a crash trolley, you have adrenaline injections. Why? Because many a times we give penicillins for treating a lot of conditions. And because of that, there is anaphylaxis, which occurs, and it's an immediate hypersensitive reactions. So it needs a rapid treatment. So for that, we have adrenaline injections. Immediately, whenever you experience an anaphylactic shock, adrenaline injection is given to you. All right. So that's very, very important. Can you share the link of the meeting? One of my friends wants to join. All right, Vinod, it will be shared in the chat box soon by one of our team members. Do not worry. All right. So you did not take my name. Yes, Ranjan. Absolutely. Chalo. Let's move forward. So adverse effects. One of the most common adverse effects that is asked in the OPRA exam, PYQ, is this CDID, Clostridium difficile induced diarrhea, which is commonly called as pseudomembranous colitis. So there are two major drugs that cause this disease. clindamycin, and penicillins. These are the two major agents that cause CDID, which is nothing but Clostridium difficile induced diarrhea. Clostridium difficile induced diarrhea, CDID. It's caused by clindamycin and the penicillins. Also, let me tell you, which is, so this is treated by what? If there is diarrhea, diarrhea is also of unique types, and it can be a question from the biomedical sciences for you. If you talk about diarrhea, diarrhea can occur because of E. coli, because of Vibrio cholerae, because of Entamoeba histolytica, because of enteroinvasive bacteria. There are so many sources of diarrhea. We say that dysentery ho gayi, loose stools ho gaye, but behind that dysentery, behind that loose stools are a spectrum of bacteria. So that is why correct diagnosis is very, very important. Because if you do not identify the diagnosis, if you do not have an appropriate diagnosis measure, then obviously, my friend, you're going to land up in trouble. Right? Let's move forward. आगे बढ़ेंगे. Let's up, we have cephalosporins, another family member of the beta lactams. So cephalosporin को याद रखना तो सबसे difficult है. It's the most difficult thing. Naplex, I have noted your measure. That will be the question will be answered at the end of the session. The cephalosporins are the most common agents which have been asked in the examinations. So, sir, every cephalosporin sounds the same. It's like a homonym, homophone. के sir सब same ही लिखता है. Whenever we go in the exam, MCQ, all MCQ appears to be the right answer. Correct? So cephalosporin also appears same. Cephalexin, cefaclor, cefazolin, cefixime, cefipime, cefapyrome. How do we classify them? How do we classify them? Correct? So that's very, very important that we know which of the following cephalosporin falls under which category. All right? So whenever the word rol comes in the MCQ, or where rol comes in the drug, ceftrolin, cefpyrrole, that is a fifth generation cephalosporins that are only given by the parenteral route. That are only given to the parenteral route. They are also in the LASA. Absolutely. LASA is a look-alike, sound-alike. Quinine, quinidine, digoxin, digitoxin, metformin, mefenamic acid. LASA, they sound very similar to each other, but have a different mechanism. Digoxin, digitoxin, different onset of action. Yes, sulfurose, good to go? Are we all good to go? Chalo. In the first generation, we have cefazolin. Whenever the word fa or fa comes, it's the mnemonic. Whenever the word fa and fa comes in the session, in the word, so definitely we have cefazolin, cefridine, cefadroxil, cefalexin, ceftolene. All right, these are the important agents that come under the category of first generation, fa or fa. Whenever you see the word pi, this word pi, in all of us would have studied in maths, 22 by 7, 3.14. Correct? QT pi, choco pi, PIE. Correct? That's a similar pi. So pi comes under the category of the fourth generation where we have cefipime and cefipyrome. Can you see pi? So naam mein hi chupa hai answer. Your answer lies in the name. Whenever you see the word pi, definitely it is a fourth generation. It is a fourth generation. All right. In the third generation, we have on, tin, in. On, tin, in. All right. So on, tin, in is nothing. Whenever you see the word cefipyrone, ceftriaxone, these are all in the third category. And rest all. जो बचा वो उसको second में डाल दो. So if you remember rol, pi, fa, this table will be at the tip of your tongue in just 2 revisions. एक बार पढ़ो मेरे साथ, once read it with me and once read alone or by yourself, all by yourself. And then the third time, you will be immediately able to recall all of these. All right? You'll be immediately able to recall all of this. So what is the mechanism? It's the same as the penicillin. So I won't be repeating the mechanism once again. Cross-linking inhibitors. So definitely they are going to disrupt the cell wall. Right, Omkar? Are we good to go? Chalo, that's great. In the first generation, so it's evening, right? And it would be maybe afternoon or night in your places if you're from abroad. So did we all have a meal for the day? All are energetic? We all are energetic. Did we all have a meal for the day? Yes. Chalo. Let's move forward. That's great. Good to hear. In the first generation, we have peck. In the second generation, we have henpeck. In the third generation, we have henpecks. In the fourth generation, we have henpecks sa. Sir, what is this? What are you talking? So there have been questions from this, that which generation of cephalosporin is targeting which bacteria. So Proteus mirabilis, Escherichia coli, Klebsiella pneumonia, peck. Add hen to the peck. Increase the spectrum. Haemophilus influenza, Neisseria gonorrhea, plus Proteus mirabilis, Escherichia coli, and Klebsiella pneumonia. Hen pecks. So what is now S and C? So S and C stands for Serratia species and Citrobacter. Fourth generation hen pecks ZA. So ZA stands for Pseudomonas aeruginosa. Pseudomonas aeruginosa. And MSSA. Can I have in the chat box what is MRSA and what is MSSA? And which is a favorite question of OPRA. MRSA, MSSA. I don't know why. And nowadays, Staphylococcus aureus, Escherichia coli, these are such high nosocomial infections, such high community infections that you experience. What do you mean by MSSA? Excellent. Kya baat hai. Very good, Vanessa. Methicillin sensitive Staphylococcus aureus and methicillin resistant Staphylococcus aureus. Some are good bacteria. They say methicillin, you act on me and kill me. They are known as methicillin sensitive Staphylococcus aureus. Some are stubborn, ziddi child hai. They say methicillin resistant. Mummy, I'm not going to get treated by you. So then you have to call the father, which is vancomycin and linezolates. So Staphylococcus says, okay, methicillin, I'm not going to get treated by you. So methicillin says, wait, let me call your dad. And then when the dad ka entry happens, vancomycin and linezolates that act on the Staphylococcus aureus. That acts on the very good Prem, very good Megashri, very good Afreen, mashallah, very good everybody. Arnav, very good. Chalo. One of the major adverse effects is INR and APTT enhancement. What is INR and what is APTT? What is INR and what is APTT? Can I have in the chat box? And how is it related to the blood clotting? Very good. Activated plasma thromboplastin time, APTT. And INR stands for International Normalized Ratio. So higher the international normalized ratio, higher the anticoagulant activity. जितना ज्यादा INR होगा, उतनी ज्यादा anticoagulant activity होगी. If there's a high INR, the coagulation clotting factors will be more, leading to a rapid anticoagulant effect. Can you give me an agent which is an anticoagulant? Any drug that we know which is an anticoagulant? In the chat box, can I have the name of few drugs which are anticoagulant, everybody? Yes, Sultana, Ravi, Yusuf, Hari, Ashutosh, Abbas. Can we all have the names of the agents which are anticoagulants? Akhil, Wasim, Shaima, Rajwal. Yes. Ishra, Zaid, Tawhid, Rishikesh, Sanjana. Can I have few answers? Very good, excellent. Dipyridamol, aspirin, warfarin, clopidogrel, ticlodipine, prasaguerel. They're all antiplatelet, anticoagulant agents. Kya baat hai? Very good. All right. Are we all clear till here? Are we all clear till here? Are we all understanding? Do we have any doubts up till now? This is the way that we are going to study in at academically with us. Whatever is important, because you have a very short span of time, correct? Now there's the exam that's going to be November, December, then the next exam is again going to be after a few months, 3-4 months. So how do we cover the ocean-like syllabus within just within just a time span of 3 to 4 months? So that is what we have with us, a library and important topics which are to be clearly, thoroughly studied by you. All right, so that's what you're going to learn with us out there. All right. So is my screen now visible to you back again? This is a beautiful representation of the, let me just change, protein synthesis inhibitors. So here we have aminoglycosides, tetracyclines, macrolides, chloramphenicol. These are some of the most widely used agents. If you see, doctors, if you have azithromycin, upper respiratory tract infections, 250 mg azithromycin le lo for 5 days, for 7 days. Take 500 mg. Correct? If you have a respiratory tract infection, quickly an azithromycin macrolide is given to you. If you have a urinary tract infection, quickly sulfamethoxazole trimethoprim is prescribed to you. So these are some of the most commonly prescribed medications that are given to you. All right. Are we good to go? Tetracyclines. Most of the tetracyclines, like we have doxycycline, we have minocyclines, they are not commonly given. All right. They are given for specific disease like rickettsia, Rocky Mountain spotted fever, Lyme's disease. So it is a very disease dependent drug. And another category of drug that we have out here is aminoglycosides, which are highly toxic, drugs. So they are usually given topically. Aminoglycosides, you would have heard about soframycin. Correct? It has fremycetin in it. It's an aminoglycoside. Soframycin cream laga do wound healing ke liye ya fir to prevent the burns. Correct? Many a times we all apply soframycin cream for healing the wounds. Correct? Like betadine, besides betadine. So aminoglycosides, may we have cysomycin, gentamicin, kanamycin, lot of aminoglycoside agents. But most of them are not given systemic. They are given through the local route, especially neomycin. It can cause ototoxicity, nephrotoxicity, and neuromuscular blockage. It can damage your ears, your kidney, as well as your neuromuscular functioning. Let me have a small rapid fire sessions with you. Let me stop the squaring of the screen. Let me see how prepared we are as audiences. All right, because we all would be B farm or M farm, maybe some of you. So I'll be taking the names of few adverse drug effects. All right. So let me know that whoever answers, and whoever gives the most of the answers, a special discount or a special gift will be given to them. All right. So let us see who answers the first and who answers the most correct. All right. I'll be asking you just 3 to 4 questions. So the first question: Gray baby syndrome is caused by which drug? Gray baby syndrome is caused by which drug? Excellent. We have the right answer. Very good, Shafaq. Very good, Mughal. Very good, everybody. The one to answer came. Somebody from the team, just note down the name. Alicia. Very good, Alicia. Chloramphenicol. Second question: Which drug cause? And I'll tell you the adverse effect. If you tell me which drug causes that adverse effect. All right. So the adverse effect ka name is red man syndrome, and the options are vancomycin, amiodarone, nitrates, warfarin. Red man syndrome is caused by, excellent. So the right answer is given by Shivam Rathi, vancomycin. Very good. Very good, Ria. Very good, Kunal, Manisha. Kya baat hai? We are already high on our preparations, it seems. That's great. See, this is what is going to help you. If you have the same momentum, if you have the same energy, if you're on this page with us, definitely nobody is going to stop you. All right. Very good. The third question to you. Can you tell me which, I'll be telling you a interaction. I will be telling you an adverse effect. You have to tell me which drug is set to cause that effect. All right. So there's a 62-year-old lady, and this was an opera question. All right. So let me see how many can solve this opera question. There's a 62-year-old lady. She is suffering from depression. All right. And she has got hypertensive crisis after taking these drugs. So what is the drug that she's taking because of which she has got hypertension? Options: selective serotonin reuptake inhibitors, selective norepinephrine reuptake inhibitors, MAO inhibitors, none of the above. I'll repeat the question once for you. There's a 62-year-old lady. She is already got the right answer. All right. But still, I'll repeat it for the audience. This is a 62-year-old lady. Just give me a 1 minute. Thoda sa pani pee lu. And I want you all to drink water as well. थोड़ी सी आपकी neck को exercise दे दो. Quickly exercise your neck. It's very, very important. From the past 1 hour, you're only listening to me. You're only watching the screen. Just give your eyes a break for 10 seconds. All right. Have a break. Have a Kit Kat. Quickly, just for a second. All right. So there's a 62-year-old lady. She's suffering from depression. All right. And after suffering from the depression, she has got hypertensive crisis. So depression and hypertension ka lena dena kya hai? Hypertension is a totally neurological condition. While sorry, depression is a neurological condition, while hypertension is a cardiovascular manifestation. How do you link them? So there is a drug which has been given as an antidepressant to the lady, which has caused cheese reaction to the lady, leading to the increase in the blood pressure and the vasoconstriction and a sympathetic outflow, causing a hypertensive crisis, which is nothing but MAOE inhibitor, moclobemide and chlorgyline, excellent sulfurose, and the antidote or the drug of choice to treat this condition is intravenous phentolamine. Very good. Very good. Chalo. So the last question, I guess we all had different three names, right? Who got the name out here? Who was the first one to answer? Raghav Sharma. All right. I hope the team members are writing down the names, because if they come to you, I want them to get special discounts. All right. Because they really deserve it. They have earned it. They have earned it on the merit. All right. Chalo. Very good, Megashri. Tyramine rich foods has an interaction with these agents. The last question, the decider rounds. All right. Yes question आपकी screen पे ये रहा. The question says, which of the following drug is a commonly causing drug which are effect of Loeffler's syndrome? I'm typing the name in the comments box, all right, on the YouTube as well as on the comment section. So everybody, why do we have so less engagement on YouTube? Everybody, quickly, एक like की बौछार कर दो मेरे पे, quickly. Can I have a stream, a flow of likes coming up? Loeffler's syndrome is caused by which drug? Option A, serotonin syndrome is all right. SSRI, very good. Appreciated, Kef, Ahmad, and Raghav. But my question again is, Manisha Paritosh, Loeffler's syndrome is caused by which agent? Option 1, nitrofurazone. Option 2, nitrofurantoin. Option C, amiodarone. Option D, none of the above. Loeffler's syndrome. You would have not heard maybe about this syndrome, right? It's a rare transitional syndrome where respiratory or lungs, there's a high parasitic inflammation, eosinophilic conditions where the RBCs counts is increased, the WBCs count is increased, the eosinophils level inflammation, because the most common markers for inflammation is your tests. So we have, if you have to check the cardiac function, you have the cardiac function tests, troponin, CKMB. If you want to check the kidney, you have kidney function, renal function test like creatinine, BUN, blood urine nitrogen, GFR. If you want to check the lipid profile, blood cholesterol, HDL, LDL. If you want to check liver function, SGPT, SGOT. If you want to check the hematological, RBC, WBC, platelets, hematocrit, MCV, MCH, PCV, etc. All right. So there is a clinical biochemistry, which is very, very important. Very good. So we have already got the right answer, nitrofurantoin, given by Surferose Shake. So Surferose Shake, very good. So we have 4 different winners from 4 different questions. So I hope the team has noted down the names. Definitely, whenever you contact them for the course, you will be getting a heavy discount at least. Yes, that's a special request from my end. Chalo. Let's start with the last session, the last part that is pending, so that we can wind up the session. All right. Yes, are we good to go? Everybody, are we high on energy? Tetracyclines. All right. So tetracyclines. Tetra means 4. Cyclines mean 4 rings fused together. When the 4 rings are fused together, very good. The normal count of SGPT, SGOT. Good one. Very good, Shiva. On the YouTube, very good. Naeem, Lalchand, Shivakshi, Danish. Very good. Very good. Chalo. So the tetracyclines, we have minocycline, doxycycline, demeclocycline, all of these agents. But one major adverse effect of tetracycline is what? It causes discoloration of the teeth. The teeth becomes discolored with the help of whenever you consume these tetracyclines in excess, and there's a syndrome with caused Fanconi syndrome. Fanconi syndrome. This is the most common symptom of, there's other adverse effects like tendinitis and all as well. But the major ones are these two. The major ones are these two. All right. Phototoxicity, absolutely. Fluoroquinolones, very good. Who's that who answered phototoxicity? I can't see the name. Very good, Kunal. Yes, phototoxicity is caused by fluoroquinolones and tetracyclines. So what does tetracycline do? It binds on the 30S ribosomal subunit chupke se, and it prevents the protein synthesis. It causes misreading. In our lives, we have our good friends and bad friends. Good friends lead us to the correct part, to the success part, while the bad friends mislead us, right, towards the drugs, abuse, addiction, or some or the other mischievous activities. So, tetracycline is like that bad friend who misleads the RNA. He tells RNA, what are you doing? Let me bind on you. You're going on the wrong part. You do not have to synthesize the proteins. And it leads to protein synthesis inhibition. All right. So that is what is the function of tetracycline, binding on the 30S ribosomal subunit and preventing the infection and preventing the protein synthesis. All right. And it's an example of a bacteriostatic agent. It's an example of the bacteriostatic agent. All right. So the tetracyclines have an absorption ability, complexation ability with calcium, magnesium. So in the exam, they will never ask you कि calcium के साथ which drug has an interaction. They will ask you a patient is on an antacid having calcium hydroxide, is given tetracycline, but the effect, the efficacy is not so high. What's the reason? So now you should know that calcium hydroxide is an antacid. It has calcium. Wo calcium is forming complex with tetracycline. That's the reason the efficacy is low. Correct? So they will never serve everything in a platter to you. Everything will be having a very, very deep and meaningful case-based or a clinical scenario. So that is what we are going to prepare you. And in the classes, definitely we have a clinician with us as well. We have Nishta ma'am who will deal up with the entire clinical part. She's an MBBS doctor. All right. And me, Kiran ma'am, will be taking our entire pharmacology and therapeutics. So definitely we have expertise in both the fields. So that's going to be an added advantage with you. है ना बोलते हैं ना सोने पे सुहागा. So you'll be having both the expertise, clinical as well as non-clinical. And another thing, do we eat doxycycline with milk? Can we have doxycycline with milk? No, sir. Again, milk has calcium. So it is an exaction. A drug can interact with another drug, a drug can interact with another food, a drug can interact with the juice, like the grapefruit juice, a drug can interact with another nutraceutical or indigenous system. Many a times the doctor takes patient history. So he asks the patient whether he is on any nutraceutical, any herbal, any other supplements, because a polypharmacology, polypharmacy is very common in today's days. People don't rely on one system. And many a times these causes drug food, drug alcohol, drug herb interactions. Suppose if a patient is having calcium and iron deficiency both, so will you give both of the supplements to him? No, my friend, calcium and iron are enemy of each other. Calcium is always prescribed in the morning, and then you are advised to walk for 10 minutes so that the bone deposition is not occurring. And the iron tablets are given in the night, not at the same time. एक को सुबह देते, एक को रात को देते. One is given in the morning and the other is given in the night. Because when you give them together simultaneously, a concomitant administration will lead to the decreased efficacy and decreased therapeutic effects. All right. So what are the different agents in which we can use these tetracyclines? We have Rocky Mountain spotted fever, rickettsia, Treponema pallidum infection caused by syphilis, Helicobacter pylori, ulcer, Vibrio cholerae, brucellosis, Plasmodium, especially those which are resistant to chloroquine, Chlamydia, plague. अच्छा plague का दूसरा नाम क्या है? What is another name for plague? Plague. Can I have answers for that? Yes, Prem, Mahira, Alicia, Manoj, Sudha, Giri. Can I have few answers for that? Juliet, Tamim, Sudisha, Rahat, Raghav, Monica, Ria, Brahmpali, Shafaq, Fitzi, Paritosh, Kayamat, Shoaib, Jaspri, sorry. Mohan, Siddiqui, yes, Rishikesh, Sanjana, Black Death. Kya baat hai? Some death. It's called the Black Death. The skin appears extremely black. Yes, Inshra, Arnav, S, Megashri, Ashutosh, Wasim, Ravi. Are we all good to go? Sultana, Yusuf, Ravi, Shubham. Chalo, that's great. High on energy, man. High on energy. From start till the end. That's great. So these are the tetracyclines. The next thing that you need to know is the adverse effects. So tetracyclines, oxytetracycline has to do with the discoloration that I told you, becomes yellow. Demeclocycline causes damage to the kidney, which is Fanconi syndrome. Kidneys nephrotoxicity. Metacycline is phototoxic. Somebody mentioned that, right, in the chat box as well. Right, Akriti? Right, Sivakshi? Danish? Lal? Chalo. Uh, so these are the agents. Vestibular dysfunction, doxycycline, mostly, vestibular dysfunction is caused by, that's an example of ototoxicity. It can be either cochlear or vestibule. So as per the anatomy, you have the cochlear region, which is responsible for your maintenance of equilibrium and posture. If the cochlea is disrupted, you feel dizzy, chakkar aa rahe hain, गोल गोल घूमने लगती है चीजें, right? So because the cochlea is being disrupted. And the last part, the pregnancy and the breastfeeding. It is a category D drug. My friend, US FDA has given 5 categories of drug: A, B, C, D, X. X, highly toxic, do not give in pregnancy. D, highly toxic, do not give in pregnancy. C, toxic in animals. So could be toxic in humans as well. So avoid in pregnancy. B, secreted in the breast milk, avoid in pregnancy lactation, specifically within the first 6 months when the child is after the delivery, after the parturition. Because in the breast milk, this can be excreted. And A, safe. You can give this in pregnancy, like the paracetamol, you can give heparin, you can give propylthiouracil, you can give labetalol for preeclampsia, hypertension, or the blood pressure in the pregnancy. Because pregnancy mein diabetes, blood pressure hona is common. Folic acid deficiency, these are all very common conditions. So in the pregnancy, you're throughout given folic acid supplementations. Correct? After the pregnancy, after the child is born, continuous calcium and iron supplements are given because your body is lacking the calcium and iron. And you need more calcium and iron for the newborn as well, because in the breastfeeding, the child, along with the antibodies, there should be some transfer of nutrients, minerals, micro and macronutrients. All right. So that is the reason why calcium and iron supplements are also co-prescribed, are also given after the pregnancy, after the parturition. All right. So that marks the end of the session, which and it aimed to cover, give you an idea, a roadmap. Okay, if you are studying pharmacology, if you are studying your antimicrobials, so it is so vast. What to study, sir? How much to study? And what is important? What part we should focus on? That is what this lecture aimed at. So I hope that it gave you an clarity and have a clear vision for you that if you want to qualify opera, have a great recognition, go to Sydney, Melbourne, Perth, Brisbane, in anywhere in Australia, and settle out there, have a great lifestyle, have a great pay. That's very important, right? Per hour pay, good pay, and good weather and out everything. So that's going to help you out to crack this opera. Thank you so much, everybody, for your patient listening throughout the session. Appreciate it, Alvi. Thank you very much. So I'm open to doubts and queries up there. If anybody has any queries or any doubts, you can quickly type in the chat box. Shoaib, Fez, you can just let me know if we are supposed to start with the
Yes, sir.
Q&A.
Yes, sir. You can pass.
Sir will be joining in a bit.
All right, all right, all right. So in the meanwhile, till the sir joins, if you have any queries with respect to opera, you can ask. Yeah, you can raise your hands first, and you will be unmuted by the team. All right.
Yes, sir. You can take a query one by one.
All right, Shoaib. Thank you very much. I guess Sagar Vaidya has raised the hand. We can unmute Sagar Vaidya. the fees for the OPRA exam? Well, we have a very, very good scholarship exam as well for the meritorious students. So once you give that exam, on the basis of your score, the fees will be conveyed to you, right? The counselors will be, you can connect to the counselors. Maybe we can add the details in the chat box and the comment section if they wish to contact a person. POC, point of contact, can be dropped down in the comment box, right, for the students. How many questions from the calculation part? See, from the calculation, from the pharmaceutics, we have the questions on stock solution, dilutions, on your basics of Sutix only. Mostly questions come up from dilution, loading dose, infusion rate. These are the major domains. So in detail, you'll be getting to learn during the sessions with us, definitely, of how to solve them in how less time. How do you solve these questions? What is the price of the course? Again, it will be conveyed to you after you give the examination. A very good lecture that actually pharmacologists. Thank you very much, Kunal. Appreciate it. Yeah, anybody else who has raised the question? Shoaib by one, we can unmute. I guess Shrikant. Yes, I think so. Akram sir has joined with us today. Hello, sir. Good evening.
Hello, Payam sir. How are you?
I'm good, sir.
Guys, please unmute and ask the question. If you have any question related to the topic, please ask. Payam sir is here. Or if you have any other questions, I am here also. So next is Harshita. Can you please unmute? Or Muhammad Ali? Good evening, Arnav. Harshita, can you please unmute, or Muhammad Ali? Are you guys able to unmute? Good evening, everyone.
Hello, sir. Good evening.
Hello,
Yes,
sir.
Harshita. कोई क्वेश्चन है आपका हर्षिता?
हाँ जी सर मैं जानना चाह रही थी कि अप्रोक्स जो टोटल फी हमारी होगी सर, जैसे कि मैंने आपको आपके मतलब इंस्टा पे भी बताया था कि मेरे पास मैसेज आया था, मुझे नहीं पता वो सही था या गलत है, इसलिए सर मतलब अप्रोक्सीमेटली सारी मतलब चीजें जानना चाह रही थी।
हाँ।
या तो सर ऐसा पॉसिबल हो कि आपकी टीम मेरे से कांटेक्ट कर ले पर्सनली।
Yes, they will connect definitely. अभी ये वो आपसे कनेक्ट करेंगे. So Abbas, please हर्षिता को कनेक्ट करा दो कोई फ्री है तो. Neha, are you there?
Sir, I am also want to know about the detailed in OPRA exam, detailed photo.
Yeah, तो basically OPRA कहता है कि डॉक्यूमेंट वेरिफिकेशन होता है, उसके लिए जाते हैं $810. एग्जाम की फीस होती है $2190 ईच स्टेप का अलग अलग गवर्नमेंट का फीस है. And our team will connect to you and they will give you the details. Each step में how much you need to pay to the government. Okay.
Sir, there was one question by Sagar Vedya. How much time is enough to prepare for OPRA?
Because there's so many students pass this exam within 2 months, some take 3 months, some take 4 months. So it's up to you how many hours you devote it. But if you can, on an average, if you can study 4 hours, 5 hours per day, within 3 to 4 months, you can clear this exam.
Yes. And sir, we have a live example. One of our students from Pakistan, in 1 month, she qualified with us thoroughly.
Yes.
She joined us 1 month. She was even pregnant during the phase, but still she qualified with us.
Akriti, so for OPRA, there is a unlimited attempt, but each time you need to pay the fees.
Right.
OPRA exam में
Arnav,
unlimited attempt होते हैं, कोई attempt fix नहीं है.
Yes.
जैसे for example for Gulf country there is only 3 attempts, but Australia में unlimited attempt होते हैं, but each attempt का आपको fees pay करना होता है.
Arnav Kapila, we can unmute and ask our query. All right.
So, sir, I have a doubt about GPAT exam.
Yes. Please ask.
So,
Go ahead.
please clear about the all information regarding GPAT exam.
All right. So GPAT is like a entry door. It's like a darwaza to almost every exam. After qualifying GPAT, it's going to add to your resume that you have qualified a national level exam, an exam which is given by 65,000 candidates and clearing amongst the top 10% of those crowd. So that's going to be a very, very value addition in your CV. And also at Academically, we have a curated course and the expert faculties who have under 100 rank in GPAT. Myself, Tanya ma'am, Sohail sir, who will be guiding you for the GPAT course, and we will share you the link as well. Arnav, maybe in the comment section we can drop in the link for GPAT. Yes, Shoaib Bhai has already dropped in the link, so you can go watch out that course as well. Akram sir, if you like to add
And
anything.
sir, how
Yeah. Yeah.
and how can we do the job in Australia and Dubai as a registered pharmacist?
All right. So for Dubai, you need experience. If you need to qualify DHA, you need an experience of 3 years. For OPRA, you don't need an experience. Or you need, even if you're bachelor's qualified, if you have your degree, you're good to go.
Okay, thanks, sir. Thank you so much, sir.
Yeah, welcome, pleasure.
Document requirement, generally they need to see your degree, your transcript, your registration as a pharmacy in State Pharmacy Council, passport, all these documents required.
And sir, experience, how many years experience?
For DHA required 2-year experience.
Okay, okay, sir. Thank you, sir.
GATE Excel exam?
GATE Excel is an Indian exam, my dear. So maybe we can, Pranjali, you can watch out our YouTube channel, Family by Academically, where we'll be uploading. It's going to come day after tomorrow on GATE Excel. So that will be a guide for the exam.
Hello, sir.
Yes, Pooja, go ahead.
Hello, good evening, sir. सर मोस्ट इम्पोर्टेंट टॉपिक्स कौन से हैं? जैसे नवंबर में एग्जाम देना है तो 1-1.5 मंथ रहा है, कुछ ऐसे टॉपिक्स होंगे जो मतलब हैवी होंगे, उसमें से क्वेश्चंस आएंगे ही आएंगे.
All right, Pooja, see, we have in our course curated the list of library or repository of those topics. जैसे the domain, as I told you, we have biomedical sciences, clinical sciences, pharmaceutical sciences. तो अब इतने सारे में से how much can we cover in 3 months, right? So for that, you can join in with us. Definitely, there we will be having handouts with us, high yield topics के, where you have those topics in one go. के ये जैसे if I talk about pharmaceutical science, so from dosage form, from Sutix formulation, calculations, from pharmacology, microbial, CVS, CNS, important topics which have been asked. So definitely that will be given to you in the handouts if you join in and enroll with us. That's a complete package of high yield questions from OPRA. That's a grand test also, mock test as well.
नहीं सर, ऐसा कुछ नहीं है, बस इतना पढ़ लो, 1 महीने में आ जाएगा.
अगर आपको कोई बड़ा करम, yes,
एग्जाम ऐसे there is no such kind of कि भाई you to XYZ 3 टॉपिक पढ़ लो पास हो जाओगे. ठीक है, ये सेमेस्टर एग्जाम नहीं है, इट इज ऑस्ट्रेलियन एग्जाम. यू आर गोइंग टू बी बिकम रजिस्टर्ड फार्मासिस्ट, राइट? तो वो कहीं से ही पूछ सकते हैं, ऐसा कोई भी वो नहीं है. बट देयर इज सर्टेन टॉपिक्स होते हैं जो हाई यील्ड टॉपिक, जो हम लोग हमेशा बताते हैं अपने कैंडिडेट्स को.
Hello.
Yes, smart boy.
Sir, after sorry, I have to change my name. Sir, क्या बोलते हैं, जब ओपरा अपन क्लियर करके जब ऑस्ट्रेलिया जाते हैं ना सर, तो जाने के बाद अपने को डर अच्छी जॉब मिल जाएगी डायरेक्ट, या और जॉब्स करना पड़ेगा मास्टर्स के लिए?
बेसिकली अगर आप यू नो there is 3 chances you can apply PR visa, work visa, even study visa, you know. So if you pass this exam, if you are going on a study visa, so obviously you get job in pharmacy. अगर आपने एग्जाम पास नहीं किया तो फिर आपको और जॉब करना पड़ेगा.
ओके
ओके
ओके सर. और सर DHA के लिए जो 2 years एक्सपीरियंस होना है, अब बैचलर्स में रहते हुए एक्सपीरियंस निकाल ले सकते हैं क्या आफ्टर बैचलर्स? क्या?
No, the experience must be after your registration is done, you have the degree, and after that 2 years of experience in a pharmacy as a pharmacist, not during your bachelor's, my dear.
Okay sir, thank you.
Yes, clear, all good in Hyderabad? How much is the cost?
Doctor eligibility is the Bachelor of Pharmacy or Doctor of Pharmacy, you are eligible. And for our course fees, you need to attend a test, a scholarship test. Based on your score, our team will let you know how much you need to pay. Okay, guys? I think they do not have much questions, so we can finish.
Absolutely. And if anybody has any queries with respect to what is
Yes,
OPRA,
our
how do
team
we
will connect to you and they will, you can talk to them as much whatever you have questions. Okay.
absolutely. And if anybody has any questions of what is OPRA, so we had a webinar or completely on about OPRA, what are the subjects, what are the weightage, everything. So we can drop down the link as well in the both the sections where you can get a glimpse of about OPRA, because many people are asking what is OPRA. So this was a master class about a lecture of OPRA. So if you want to know about OPRA in detail, we have a lot of videos on YouTube, Dr. Akram Ahmad's YouTube channel. You can go and have a glimpse about the exam as well. And Shoaib Bhai has already dropped in the link for the scholarships and all the meritorious students, because Akram sir and Academically have a vision of uplifting the meritorious students and promoting their talent, right? By giving some financial assistance, whatever is possible at our end. So if you score well in this scholarship, you will be getting a very, very good amount that can be helpful in your course ahead. All right. So this is a very good scholarship program provided by Academically for you.
Okay, guys, thank you so much. I think we can finish here. And please wait for tomorrow. Our team will connect to you and they will guide you one-on-one. जितने भी questions हैं आपके आप उनसे वीडियो पे बात करो तो ऑडियो पे whatever you prefer, they will guide you. Okay, guys, thank you so much. Thank you. Bye. Good night.
Thank you, sir. Thank you, everybody. Have a great weekend.
Sir, 1 second.
Thank you,
Ms.
sir.
Harshita,
Yes, sir.
Ms. Harshita, are you active?
Yes,
Yes, sir. Yes, sir.
Yes. Can you drop down your name, number, and email in the chat box?
अरे उसी में ही आ जाएगा ना यार.
Just you. Sir, I can't find it in the sheet.
अच्छा.
जी.
Okay, sir.
Can you please leave your phone number, email? So our team will connect to you.
Yeah, we will arrange a call
Okay,
back
sir.
immediately.
Sir, SMS email ID.
हाँ चलो email दे दो, phone number है तो अभी अभी connect कर लेंगे आपसे.
Just drop your phone number. We'll get in touch.
हैं? यार ये